Hi, thank you everyone for joining today's webinar on state strategies to strengthen local community responder programs. My name's Felicia and I work in the Behavioral Health Division at the Council of State Governments Justice Center, and I will be facilitating today's webinar. Next slide, please. Here's an outline of our agenda for today. First, we'll go over a brief overview of the CSG Justice Center, the community responder team here, and a review of the expanding First Response Commission, along with the recommendations that have been recently released. Then we will hear from our keynote speaker, Melissa McKee, about policy solutions grounded in lived experiences. And then we'll have a really great panel discussion centered on the expanding first response scaling for states recommendations. Towards the end of the webinar, we'll have some time for questions and answers before wrapping up. I do want to go over just some quick housekeeping. So anytime during the webinar, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. So this includes both technical and content related questions, and we'll try to reply to technical questions we'll try to reply to technical questions in the chat as we go, but for the content related questions, we'll keep a running list and address them at the end of the webinar. We'll do our best to get through as many questions as we can, and if we are not able to get to your question, we will follow up with you after the webinar. If you encounter any technical or audio problems during this time, please refer to the information that's going to be posted in the chat or that has been posted in the chat. Please understand that there are some technical issues that we're not able to resolve while the webinar is running live, but we are recording it and it will be posted along with the PowerPoint slides on our website within the next week or so. Next slide, please. Okay, thanks. The Council of State Governments Justice Center is a national, nonprofit, nonpartisan organization that combines the power of a membership association representing state officials in all three branches of government with the expertise of a policy and research team that's focused on assisting others to attain measurable results. So our staff develops research-driven strategies to increase public safety and to strengthen communities. So this slide describes a little bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. So I'm part of the community responder team here at the CSG Justice Center, and we support community and state transformation by combining research, resources, and hands-on technical assistance with the lived and professional experience of our team and partners. Our goal is to help develop and integrate community responder programs into the first response system. And we do this through publications and toolkits, events such as these, and presentations, learning communities, technical assistance, and more. And we're pleased to be joined today by Hallie Fader-Tao, Director of Justice and Health Initiatives for the CSG Justice Center's Behavioral Health Division, who will share a few remarks with us.
Thank you, Felicia, and good afternoon to everybody. As Felicia said, my name is Hallie Fader-Tao, and I have the honor to direct our justice and health work at the Council of State Governments Justice Center. I am wondering how many of you are here this morning because you thought the title might be something of an oxymoron. How can states support something that is as intimate and inherently local as crisis response, as how community members develop and secure a sense of safety? Our team has really been working hard to understand what facilitates effective community response. Where are there state strategies that can bolster what works or get out of the way so that communities can innovate and develop strategies so that all members of the community feel safe? We're very committed on our team to identifying state policy and promoting state policies that create a framework that facilitates effective implementation. And I'm looking forward to the conversation this afternoon and the conversation that is ongoing about what state policymakers and leaders can do to support safe communities. Thank you all so much for being here. Looking forward to the presentation and also hearing from the audience your questions and where you're going to go from here with the information you've learned. With that, I will turn it over to the leader of our community response work, Ann Larson.
Sorry, everybody. I gotta get back to working on my computer. Thank you, Hallie, and I just really want to extend a welcome to everyone. It is National Co-Response and Crisis Response Week, and for all of you that are doing this work on the ground or supporting the folks that are doing this work on the ground, I want to celebrate you. You are the local champions that we need in this space. Next slide, please. So when we're talking today about community response, I really want to ground us in the definition that we use here at the Justice Center and how for you to imagine these recommendations and the folks that are going to talk about the work that they've done. So we believe that community response offers an additional option in the first response landscape. We believe that these are professional partners that respond to calls through 911 or 988 in response to really folks that need assistance, often due to poverty, substance use, mental health, or really like social determinants. And we believe that integrating community response programs into the first response landscapes ensures that everybody is getting the right response to their calls for assistance and help. Next slide. So we started our first expanding first response commission in 2023, and we had 21 commissioners at that time. And through that work, we came out with some really great emerging practices for local communities in establishing their own community responder programs. And so then the next step in that was like, well, we've got these local proofs of concept. We've got these programs across the country that are doing amazing work. How can states really support local communities in their expansion or establishment of community responder programs? So we brought back together some of our original commission members and then bolstered our commission ranks to 29 members from across the country to really work through like how can states support through funding, through partnership, through call triage, how can they support local jurisdictions in their expansion or establishment of community responder programs? Next slide. So I'm not going to go through the 3 slides of the commissioners, but I really wanted to just demonstrate the diversity of geography of where these folks are coming from, their spaces. We've got faith-based leaders, elected leaders, law enforcement, fire, advocates, folks that are working in the behavioral health realm, researchers that have really sat down and together they came up with consensus to define our 5 recommendations for how states can support local programs. Next. So what do these recommendations look like? You can find them all on the link and we'll be sure to drop it in the chat. But what we heard from folks is that they really didn't want a deep report. They didn't want 30 pages to look through to find what these recommendations would be. So we've produced 5 one-pagers that are dual-sided that really just give like the top 3 recommendations for how states can support community responder programs through funding and sustainability, workforce, and dispatch. Next. And data sharing and partnerships. So partnerships was just published, I think, last week. We're thrilled that it made it to this point where we're having a conversation. And with that, I really want to make sure that we have enough time so that you can hear from the commissioners and their voices and our keynote speaker on why lived experiences and lived expertise is so important in framing and remembering the why of this work, and then hearing from our panel on how they worked together through consensus to come up with these recommendations. So with that, I am thrilled to introduce my dear, dear friend, Melissa McKee, who has been a part of my life and a part of this work since 2017. I'm thrilled that Melissa is able to carve out time in her day-to-day to talk to us. And Melissa, the floor is yours.
Thank you, Anne, and thank you everyone for being here. I'm really happy to be here with you as we celebrate the release of the expanding First Response Commission recommendations for state strategies to support local community responder programs. This work matters because it's smart policy and it's rooted in people, communities, and lived experience. Before we dive into recommendations, I do want to share a little bit about my personal journey to this moment. I didn't end up here just because I studied policy. I came through lived experience, unmet behavioral health needs, domestic violence, incarceration, and years of feeling unseen and unheard by the very systems that were supposed to help me. After my release from over a decade in the carceral system, I knew that I needed to rebuild in a different way. Part of that journey was going back to school. I earned both a bachelor's degree and a master of public administration with a focus on public policy. And that education gave me the language and the tools to connect what I lived through with the systems that I wanted to help change. During my sophomore year in college, I began working with the Olympia Police Department's Familiar Faces program. There, I had the opportunity to work alongside Ann Larson in the Crisis Response Unit, and I got to see every day that when people in crisis are met with care instead of punishment, trust and healing follow. That experience convinced me of something that I carry with me always. Community responder programs don't just work in theory. They are practical, life-saving solutions for community safety. It's important to acknowledge that I didn't arrive at this moment alone. I stand here because of the power of champions, people who hold doors that you can't yet reach, people who stand in the gaps that you can't cross alone. Ann Larson is one of those champions for me. She believed in me before I believed in myself. She pulled me into policy and helped me see that lived experience belongs in these spaces of design and decision-making. And that changed my life. Today, part of my personal mission is to be one of those people who can now hold the door open for the next person. See, there's a big difference between knowing about something from the outside and knowing about it from the inside. I recently accepted a position at another law enforcement agency, and I want to say up front that it's meaningful work, and I'm grateful to be there. But I'm also going to be honest. Sometimes it can be difficult in that environment. Not long ago, I was speaking to a colleague about the challenges of working inside a law enforcement agency. I shared how difficult it can be in that environment, given my history. She replied, "I hate it too sometimes. I just don't talk about it at work." And that struck me, because for her, the problems were visible. But for me, they're visceral. I don't just see what's missing in our systems. I remember it. I remember being a young pregnant woman nearing my due date, shackled at my ankles, being transported from jail to a prenatal appointment. The chains were too short to let me step into the van, so I had to crawl on my hands and knees to get inside. And no amount of studying the criminal legal system or women's experiences within it can match that. And as I look back over my life before incarceration, I see so many moments where a different response, someone understanding, someone intervening, someone connecting me with support, could have made all the difference in the world and could have prevented so much of the harm that followed. That is exactly the work that community responder programs aim to do. My belief in this work led me to the CSG Justice Center in 2022, where I helped build the Expanding First Response Initiative. I want to pause here for a second, and I want to honor the Expanding First Response team. As some of you may know, our positions ended suddenly this May. But the dedication of that team was unparalleled, and the work lives on in these recommendations, in the partnerships, and in the vision that we shared. So as Anne told you, between January and March of this year, the commission, made up of practitioners, policymakers, people with lived experience, researchers, and advocates came together for a second time to chart the path forward. As you heard, they defined community responder programs as multidisciplinary professionals trained to address behavioral health and quality of life concerns, providing a person-centered response to 911 and other emergency calls, ensuring that all calls can receive the most appropriate response. But they didn't stop with defining it. They gave states a roadmap for how to sustain this work. First, funding and sustainability. States must move beyond pilot dollars. That means legislation, dedicated grant programs, tax-based support, embedding responder programs into statute. Community responder programs aren't side projects. They're essential public safety infrastructure. Second, workforce development. Responders need strong training, professional protections, and clear career pathways. That's how you create legitimacy, stability, and retention in this field. And third, the data and dispatch integration. We just can't measure what we can't see. States must set standards for data collection, fund cross-system data sharing, and ensure responder programs are fully integrated into dispatch protocols. Dispatchers are the front door, and they need to be part of the design. So why should states care? Because community responder programs are both compassionate and practical. They reduce pressure on police and EMS. They keep people out of jails and prisons. They build trust in communities that have too often experienced harm instead of help. But they can't survive on passion alone. Without state support, without stable funding, workforce investment, and data systems, we risk losing momentum at the very moment that we should be moving forward. Without state leadership, we risk leaving community responder programs vulnerable to the whims of political priorities or local budgets, and in today's climate, that's a risk that we can't take. I want to close where I began, with lived experience. I've had the privilege of holding multiple perspectives. I've been both the person needing help and not getting it, as well as the one showing up to respond in the field, while also shaping policy behind the scenes. And what I've learned is this: community responder programs work. They help. They save lives because they center humanity and deliver the right response at the right time by the right people. This commission has handed us a roadmap. Now it's on us, and especially our state leaders, to turn these recommendations into reality. Thank you.
Thank you, Melissa. I'm not crying, you're not crying. It's great to see you, and I'm so thrilled to be able to elevate your voice in this space. I'm a big believer that we need to have people with lived experience at every intersection of this work, from direct service to policy and in leadership positions. So thank you again for saying everything in a way that is in my brain, but will never come out of my mouth in a way that you can make it come out of your mouth. I'm so thrilled to have you join some of our friends from the commission in a panel discussion to talk about the work of the commission and their thoughts for state leaders and folks in community that want to expand first response. So it's my pleasure to introduce Candace Coleman from Access Living, Andrew Demerin from Denver 911, and Amy Watson from the School of Social Work at Wayne State. All three of these humans are incredible, not only in the work that they do every day, but in the way that they work, the way that they show up, their kindness, their openness, their curiosity is noteworthy. And so I'm thrilled to be joined with you all today. So Andrew, Amy, Candace, I'm going to call on you one at a time so that there's not awkward looking at each other. But I'm going to start with you. I'm going to start with you, Andrew, because you have been on both commissions, correct?
That's
All
correct.
right. And I want to hear about like why it's important for you to take time out of your job. Like you are a busy human. Why is it important for you to show up in the space and join a national commission, especially around conversations around community response and scaling for states?
Well, thank you for putting this together and for giving all of us the opportunity to contribute. I also want to thank Melissa for that keynote presentation. That's the first time I've had the pleasure of hearing her story, and it was incredibly powerful. I joined the city and county of Denver as the director of Denver 911 in August of 2020, 2 months after the STAR program pilot began. So I was thrust into a position where I had the responsibility to steward something that had been built by others, folks in our community, folks within the city who had put a lot of blood, sweat, and tears into creating an alternative response program, a crisis and community-based program, kind of into operation. And I had my work cut out for me because this was not my area of, this is not where I came from. My background was dispatching, and I was fortunate to have a lot of really forward-thinking, intelligent people who kind of gave me my first lessons about what trauma-informed response is, what it means to help people in a way that is other than the way we've always done it. So in 911, we've been dispatching police to all of these calls for service for, going on 60 years. And we're very good at doing that. We have a lot of policy, procedure, and technology that allows us to do that effectively. And now we're presented with an opportunity to do things better and to do things differently and to build that infrastructure from the ground up. So that is where I have found a real passion in this space, is getting to kind of collaborate with folks like you, Ann, and the other folks on this panel and the other commissioners, and really identify how we continue to move the ball down the field and make this self-sustaining, right? I am really looking forward to the point where webinars like this are completely unnecessary, because programs like STAR, like Heart and Care and Albuquerque's community safety are just, they're the norm and are self-perpetuating.
Awesome, Andrew. Thank you. I can't wait till that day too. So let's put a pin on a calendar for the day that we go back in history and watch us young Andrew and Ann's and Amy's and Candace's in the good old days. I'm going to go to you next, Candace, because one of the things I love about Candace Coleman is the motto, "Nothing about us without us," and the work that Access Living does in Chicago. I was lucky enough to meet Candace a couple years ago in Chicago, and I have attached myself to her ever since. But Candace, can you share with folks the reason, like, why you are in this space and you said yes to your busy life to join the commission?
Um, One of the reasons why I'm in this space is because I started off as a community organizer, organizing people with multiple disabilities. And what we were finding here in Chicago is that there was so much discourse and closures of clinics and violence against people with mental health crisis, and people needing help and not really understanding where to go. And so the community organizing group, Advance Your Leadership Power, decided that they just couldn't take the numbers and the instances of people with disabilities continually being harmed in situations where they needed help. And so we curated legislation in the state of Illinois to really seek out alternatives to police response in order to address the needs for people in mental health crisis to get the support that they needed on the ground. And so we've been on a journey since 2017, doing research, looking at institutionally what what services and supports are out there, and how can people with disabilities kind of be at the table to make decisions on what care looks like for them. And so we've been working on this legislation since 2017. It got turned into law in 2022, and we're in the implementation phase. And so I'm really excited to be in this space because we get to talk to experts and people who are in the field, as well as bring our lived experience to the table in order to figure out a system that really works for us.
Yes, thank you, Candace. And last but certainly not least, Dr. Amy Watson, who brings such a deep well of like knowledge and smarts, but also stays so close and proximate to the work that's being done. I love Dr. Watson. She's probably like cringing inside that I'm using the doctor, but Amy Watson has been on our commission for both iterations, and I'm thrilled that you're here, Amy. Can you tell us a little bit why you came back?
Sure. Well, this is just exciting work to have the honor of being part of. I've been doing work in the space of crisis response for about 20 years. I started my research career really focusing on police response to people experiencing crisis and people with serious mental illness. Did a lot of work around the crisis intervention team model. And while there certainly is a continued need to make sure that police are prepared to respond when they are needed for crisis calls, became really convinced that that's sort of barking up the wrong tree. We really need to kind of flip things from having police as primary and sometimes bringing in mental health or someone else to assist, to flip it as someone else as primary and only utilizing police when there's a specific need. So I've really shifted my work in the past probably 7 years, and it's been exciting that there's been so much work in this space to kind of observe, be part of, and hopefully have contribute to. So when I got the email asking if I wanted to come back for the commission again, I was very excited because I love kind of being in a room with people doing really innovative work, and I learn from them. And you always hope that you contribute in some way as well. So it's been very exciting and very meaningful to be able to be part of.
Thank you, Amy. All right, we're going to dig into some of the big, hard-hitting questions here. And I'm actually going to tap on you first, Melissa. So we're talking about workforce, and it's like the big question, like, what's the professional identity of community responders? What do they look like? What do they do? What are their skills? What are their resources? And the role of lived experience in that, and what lived experience can bring to community response, and also like what the role of like gender can bring to community response, and understanding that that how this work is approached when you're working with as opposed to and alongside humans, as opposed to a differential in like power. And so, Melissa, I would love to hear from you how you approach being in community response and working with folks in community, and then how that work directly framed like when you were helping communities across the country with technical assistance and thinking about workforce. Like, how do you balance what you learned directly and what you heard from communities you supported?
Thanks, Anne. That's a great question, and I feel like there are a lot of layers there. So let's see how many I can get to. I honestly think that lived experience should be baked in to these programs. I think that it should be a qualification that folks have. And that opinion is grounded in the work that we did in Olympia and the work that I've seen across the country since. You mentioned gender, and I think even from the short piece that I shared with you about my personal history, there are experiences that I've had as a woman that as occupying a female body, that can only be understood by somebody who's had that similar experience. And so having the opportunity to approach this work and to approach the community with that lens, it really just gave me a leg up. And it also gave a leg up to the people that I was able to serve. I remember one of the first people that I worked closely with in Olympia was a woman who was approaching 40. She had been homeless for about 6 years, living in a tent on a sidewalk. And she had such big behaviors that she had been exited from essentially every service program in the community. And very shortly after beginning to work with her, and I do want to differentiate that Familiar Faces was long-term case management. That's the work that it does. It works side by side with a community responder program, but it picks up the pieces where the response leaves off. And I remember sitting in a room as we were trying to sort out how to do this work, and it had been reported that this woman had recently discovered that she was pregnant, and there were all kinds of really well-meaning community partners in the room, and the overarching message was this woman can't have this baby. And because I had had the experience that I had had, because I had lived in a carceral system where somebody made that decision for me, I knew that it was not within our rights to make that decision for her. It was our job to support her in whatever way we could and to do everything that we could to keep her and that child safe while she made that decision on her own. And it was a ton of work. It was not work that could have been accomplished by a police officer or a traditional case manager. I had the opportunity to actually be in the room with that woman when she gave birth, because nobody else was there for her. And so when we talk about lived experience and when we talk about being gender responsive in our approach, it is that sort of experience, both my personal and then the professional experience, that can create outcomes. And I will tell you that the outcome of that story, it's magic. It's miraculous. There's not even a big enough word to describe how that turned out. Baby's good, mom's good, they have a relationship. She made the decision on her own. She understood that she couldn't both take care of herself and this child, and then we were able to help facilitate that. So without that lived experience, we can just set off on the wrong course, and we can, despite our best efforts, create harm. And so when I say that this should be baked in as a qualification, it is that informs that. I just took a long trip down memory lane and therefore forgot the rest of the question. But I think that might be sufficient.
Yes, more than sufficient. And thank you for the trip down memory lane. I remember getting that text from you that night with you wearing scrubs and having that little paper bonnet on your head because you were in a labor and delivery room. So thank you. Amy, I'm going to move to you because you to me are like one of the workforce go-tos when I'm thinking about workforce and the work that you've done around workforce, talking to folks that are receiving services, talking to the folks that are working directly in community response, talking to everybody, family members. So what are your thoughts on this big thing of like, who is this workforce? What is this professional identity?
So I mean, what people told us really echoes what Melissa talked about, is how important it is that people have lived experience and broadly defined that they bring to this work. And one of the things we see, though, is oftentimes people that are really the best suited to do this work may face barriers to get into the workforce. It could be, criminal history. It could simply be that they're, not going to get a master's degree because that's not part of a plan that they want or that's possible. So we've been really trying to look at, so how do we develop a pathway into the work for people that doesn't require a master's degree, that removes some of the barriers, and really thinking about kind of peeling it back to what do they need to do? What are the skills they need? What are the competencies? What values do they need to bring to the work? And so thinking about that, what we're hoping to do, and we're starting to work with the Illinois Credentialing Board to develop a credential that would provide basically provide opportunities for people that are well suited to the work to kind of come in, get some training, get a credential that kind of legitimizes what they're bringing to this work, and get them into roles as crisis responders. So I think there's ways that we can make policies that actually really legitimately recognizes the skill sets that people are bringing. And some of that, I mean, lived experience isn't necessarily a skill set, but it's something that people come in and then we can build the skills underneath them and support them, and really have a great workforce without waiting for people to get master's degrees, which may be a little bit of a mismatch in terms of the skills and the orientation that people really need to bring to this work.
Yeah, thank you, Amy. And we'll be able to link to all of the work that Amy and her colleagues have done around workforce, and be able to share out those resources. I'm going to go to you next, Andrew. So you sit in a different space often, like, so you're in dispatch. And so dispatch has to make the determination to send these calls to folks that they have traditionally not worked with. Like, this is a new integration into the first response landscape. And so, as you mentioned, when you did your introduction, like, dispatchers know how to dispatch to police, they know how to dispatch to fire, EMS, and these guys know the calls, right? They know what's happening in community. What have you seen in building confidence on the dispatcher side of, like, that workforce on the other end? And also, like, the confidence and trust of the other first response systems in having community responders kind of integrate in?
So I think the most important thing, and the first thing that we did, was that we introduced the 911 team here to that kind of differing level of expertise and subject matter knowledge, right? We had a STAR program manager who was a licensed clinical social worker who could come in and sit down with our dispatchers and say, listen, these calls that we're asking you to send STAR to, these are calls that as a community mental health worker, I used to go to all the time. And I would drive my personal car to their house. I'd go sit in their living room and, we'd sit down and we'd talk through the resources that they need, the difficulty that they're having. Now, as a part of an official city system, these clinicians have radios. They have a partner with them. They have a dispatcher who's keeping an eye on where they are. So they're actually safer doing this work now than they ever were when they were doing it on their own in the community. And to kind of provide that perspective to dispatchers who, many of whom, I have some dispatchers who have been here for between 20 and 30 years. And that culture and mindset of worst case scenario is deeply ingrained in what 911 does. We have, I think, done ourselves a disservice when it comes to programs like STAR and others, where we have drilled into our call takers and our dispatchers, you need to be thinking about the worst case scenario, scene safety, officer safety, approaching these calls with kind of a certain level of pessimism. Whereas now we are being asked to think differently, to approach these calls with optimism and empathy and assuming positive intent. And that requires a mindset shift. And so having a very different perspective was hugely helpful. But then building policy that not only supports, but mandates that. So one of the things that we did is we built a policy that allows a resident in Denver to call and request the STAR van. And if STAR isn't available because it's still not able to meet, the demand, then they have the option to say, I don't want anybody else to come if STAR can't make it, right? And in 911, that's very weird for us. Our job is to hear a thing and then send somebody to that thing. And so to create a policy that says, no, you're not going to send anybody else if you can't send STAR, was, it was a challenge, absolutely. But we got city attorney buy-in. We got the training team here to really kind of educate not just what the procedure is, but why we're doing this. So all of those things combined have meant that we've continued to try and move the needle to establish STAR and programs like it as the fourth field response option that 911 has. If you listen to the Trade-Offs podcast about Durham, right, they're the fifth branch of public safety, and that's what we're trying to do. Is, you know, during the pilot phase of STAR was an alternative to police if they were available, but police were still very much the default. And what we're trying to move toward is STAR is the assumed default. And if we need to escalate it to a police response, then we will. But we need to be thinking that a community-based response that's where our heads should be going first.
Awesome, Andrew. Thank you. And last but certainly not least, Candace, I would love to hear from you, because I feel like oftentimes when somebody at City Hall or somebody at the county or somebody is tapped with like, city employee, go research about community responder teams and come up with how we're going to build a community responder team. And then these community responder teams or alternative responses are built without that community credibility or that community buy-in or that community voice. And so how I think of you as like somebody that could give credibility or community confidence in a response coming out. And so what do you look for? Like what in a workforce for you that would be responding to community? Like what are the skills and what are the traits and what are the education that you would look for if you were to build a community responder team to respond to community?
I think initially what is important is to have understanding of the system at hand. I think additionally, folks with lived experience come in with a perspective of being on the other end of the service. And so they kind of see points of contact or points of support or points of uh, best practices for them because they've seen both sides. I think speaking a multidisciplinary level, and that comes with seeing all sides. So seeing what it looks like over here as dispatcher versus what it looks like over here as on the ground versus what it looks like on the other side. I think is important, and having a heart being a community member is extremely, extremely important. Because without that element, like you're not relatable, people don't want to listen to you. People can, you know, be in fear of you. Like all of those things come into play and perpetuate and those things. And so I think these are some of the elements that I've heard people describe what they want. But also, when I look at different programs across the country, those are the ones that work.
Agreed. Thank you.
But I know we have a short window of time.
We got a few more questions, but we are definitely, I see activity in the Q&As, and we're gonna save enough time for that, I promise. We just have a few more questions to really like hear. These commissioners and Melissa kind of represent what we put together. So my next question, I'm gonna go like the same, I'm gonna go in the same pattern, y'all. So get ready, Melissa. So non-traditional partnerships, like there are folks in community that want to help. And I think oftentimes we think of like who should be at the table, law enforcement, fire, hospital, EMS, like these traditional partners, but really there's a lot of untraditional partnerships out there, like faith-rooted organizations, your library system, the post, I mean, non-traditional partnerships. And I think the states can help facilitate that. Like the states can help like be creative in their own non-traditional partnerships and how they support community response. So do you have any specific examples or recommendations for quote unquote like non-traditional partnerships in this space?
I was hoping this was the partnership question, because I want to say the thing that I know to be true, and that's that the first word in community response is community. right? We should not be leaving the care of our people to systems. We all need to take part in that. And community response doesn't work without the partnership of the community. And you nailed it. Faith communities have so much opportunity to help bolster these efforts, as do all of our public systems, our libraries, our post office, anybody who could encounter a person who is potentially in crisis should be brought in and brought to the table and be part of the solution. Not in an applied solution sort of way. Here's the post office. You do this now. How about let's ask them some questions. What do they need and what can they do? We had so much help in Olympia, and we continue to have so much help in Olympia from all kinds of non-traditional partners. You mentioned barbershops. I had a handful of shops downtown where I could take somebody to get a haircut who hadn't had a haircut in 5 years. Things like that can make all the difference in the world. And so I think that it works both ways, in terms of like both, like how can we help and how can you help?
Agreed. And having a list of things, because people will reach out and say, how I heard about this program, I want to help. And having the program manager or the staff of the program have like a list of things that would be super helpful, gift cards to McDonald's or rides to the DMV or things like that. So just if you are developing or running a program, like things that you know you need, and how you can plug into non-traditional partnerships. Amy, through your interviews, through all the work that you've done, through your experiences of going on ride-alongs and working in the space, what are some unique or non-traditional partnerships that you've seen that really have like moved the needle on someone and the care that they're receiving?
I certainly think having relationships with business associations, because one, they will tell where they see issues, but they'll also can provide feedback. If they know that a community responder team exists, they may be more likely to reach out to that team when they're running into an issue. So I've seen that being really helpful. Something really unique. So Evanston's care team is actually housed within their Parks and Rec department. Because the Parks and Rec department has a ton of programming with youth, with older adults, and that where it sits actually makes a lot of sense, even though at first when I heard about that, it was like, oh, that's weird. So even programs that aren't housed in a Parks and Rec department might want to think about some partnerships there as well, because there's different supports and services to connect people to. It's also people in the community that can reach out and perhaps avoid something that could turn into a police response. So I think those are really important. And then the other partnership, I think, is with community colleges, in terms of thinking about training the workforce as well. You've got folks there that are really good at bringing people in and getting them into professional roles, and they're a great resource, and they oftentimes have some resources already to do that because they're designated to meet the needs of employers in the area.
Absolutely. Agreed. As a community college graduate and with a couple kids in community college, I cannot get behind community colleges more. Andrew, you've seen STAR, start off and then, adjust and adapt and pivot. And I believe that there's been newer partnerships in Denver as the team has been responding and being like, we really need to think outside the box around housing, or we need to think about outside the box around transportation. So can you speak a little bit about some of the maybe traditional or untraditional partnerships that's really like bolstered up the Denver Star program?
Absolutely. I think one of the things that is a common refrain among programs across the country is that, okay, we've built this great response mechanism, but the underlying social safety net still has too many holes in it. And we don't always have somewhere to take somebody, particularly in the middle of the night, right? In Denver in particular, a lot of our shelters close at 9 or 10. And so what we have done is, and actually a lot of the kind of community members and voices that were so integral in STAR getting launched we've now been able to kind of leverage their subject matter expertise as a sort of a bolt-on to STAR. It's kind of the, you've got the initial response that comes from the 911 call and the response, and then we have a cadre of community nonprofits that we are now contracted with and actually providing funding to help to coordinate those wraparound services. And so, one of the things that a lot of communities find is that there are some very capable but small nonprofits, and so they may not have the bandwidth or the personnel to respond to a formal RFP from your local government. So what we did is we partnered with a much larger nonprofit that does do that kind of work. They kind of act as the umbrella organization and funnel both referrals, clients, and funding to this sort of larger tapestry that is still being built, still being developed. But the idea is that we want this to be as inclusive and comprehensive an option as possible, so that no matter who STAR responds to, they have a linguistically, geographically, and culturally appropriate resource that they then can be connected to for that long-term support.
Amazing. Thank you. Candace, you're up. So Candace, one of the things I love about you is your curiosity and your hustle. I've never been in a room with you where you haven't been cornering people and figuring out how you can tap into them. And so, what are some of the partnerships or connections or relationships that you've made throughout your work in this space that have been really like meaningful and maybe outside the box or maybe inside the box?
That's an interesting question because I feel like I've been building relationships in the tenure of this work, such as Amy Watson's and you. But I think one of the things that I think is helpful and lessons learned through the work that we've been doing is that in the various systems, there are different languages that people speak in order to do their protocols, procedures, and the way that they do things. And one of the difficulties of doing this work is getting everybody to understand what that common language is. And so in order to do that, you have to build trust and you have to see how each other works and operates. In order to trust that a service or a part of the work can get done effectively. And so unique partnerships was mentioned before with various nonprofits. I have never had to work with elected officials more in my life than I've had with this with this project. In a policy space, this is an emerging industry. A lot of people are discovering, what the definition of what this means. And so, a lot of forethought in future policy and how this plays out for infrastructure and various things like that. Believe it or not, unions play a role in these conversations. And so navigating their procedures is also a thing. Um, Access Living is a disability rights organization, and I think people don't know, as a Center for Independent Living, there's a network across the country. So there's 500 plus centers for independent living across the country. And so tapping into folks with lived experience, who can speak to their experience and being at the table. Trying to think of some other uncanny relationships. I think I mentioned researchers, um, different levels of government, different levels of people with lived experience, because it's not the same person. I want to be clear about that. There's a diversity there. And being involved in a lot of people think this is boring, but a lot of infrastructure meetings, like plans for your city that come up for 30 years out. Transportation, public transportation spaces, a lot of people are there. And unfortunately, most often people are dealing with homelessness. And so being in community with people and organizations that do that work, because oftentimes that's where crises are. And that's where people need their needs to be met. And so, one other thing that has come up too is folks who are in foster care and different levels of youth spaces and juvenile detention spaces and different things like that. And so my motto is anywhere that there's people, that's where you should be. And so those are some unlikely partnerships that haven't been mentioned as of yet.
Thank you, Candace. Yeah, that's a good motto. We're gonna have to put that on a coffee mug. Wherever there are people, that's where you should be. We'll mark that one down. Okay, so we've talked a little bit about partnerships. We've talked a little bit about workforce. We've heard from your direct experiences. But one of the big questions that we always get is like, that sounds great. How are we paying for it? And how are we going to pay for it in a way that's sustainable? So we at the Justice Center host many learning communities. We provide technical assistance across the country. And we had one learning community where a fire chief was like, our city has died by 18 million pilot projects. Like, we cannot do another pilot project that we all get behind, and then poof, it goes away. And then we do another pilot project. So when we think about these programs, yes, piloting, and then how do we sustain if we're piloting, like, and we're saying we're doing a pilot, how do we pilot, proof of concept, and sustain this work? And I'm going to go through again. So Melissa, in the city of Olympia, I'm sure you heard me say this a million times, but in 2017, we passed a public safety levy that carved out funds for familiar faces and crew, along with walking patrol, community policing, and community court. So from your perspective, and from your perspective of working at CSG, what is an avenue for sustainable funding for this work?
The public safety levy in Olympia was such a critical moment for us because it did make it locked the program in. Like, we exist. It legitimized the program, the programs, and it gave us an opportunity to really build from that place. I think some of the other things that I've seen happen. So that happened at the city level. I'm not going to make it through this webinar without talking about the Seabrooks, Washington legislation in New Jersey, right? And that carved out money at the state level, $12 million for piloting these programs. But then the question is still sustainability, and also understanding that different funding streams come with different requirements. And so making sure that as we are building in this sustainability feature, that we're making it still accessible to the people who are closest to the problems to do the work. And so I think that there are a lot of different options that states have and that local communities have, and it's finding out what works for your community and how states can bolster those efforts.
Agreed. Amy Watson, in all of your work, what have you seen for braided funding, for sustainable funding? Like, what, in your perspective, is a sustainable funding model for this work? And how can states support that?
I mean, I think there's a couple things that needs to happen that make it more likely that you'll be able to obtain sustainable funding. One is, if we have pilot programs, those programs need to be able to demonstrate their value to different stakeholder groups, and finding ways of getting that story out. Some of it's kind of qualitative, some of it's going to be more quantitative data. I think that's important. So when people are making decisions that aren't as close to what it is, there's something there that will help them do that. I also think pushing the narrative of community response as another first response service, to start building it into, this is part of our public health and public safety system that's part of the structure. But in terms of actual funding, Certainly, I think working into city budgets. I know in Illinois, for their mobile crisis teams, they're utilizing cannabis tax dollars because they have a state law that returns a certain percentage of the cannabis tax to services. So I think there's places there. I know there's also some teams that are billing Medicaid when appropriate, and I think that's something that teams have to really think through before relying too heavily on Medicaid, because that comes with some specific rules of who can do the work and what work can be done. So it can be limiting if that's really something that's relied on heavily. So thinking through different funding sources, I think ideally I'd love to see it funded like a police agency is funded. As part of a city budget, it's an expected service. But certainly given the context of tight budgets, really thinking through, can we pull down some Medicaid where it's appropriate without that changing what it is we're doing? Can we pull in other sources of funding? But the cannabis tax example, I think, is a really good one, that this is possible. And certainly as states are doing 988 surcharges as well, some of that money could also be directed to another first response service. So pulling that in, I think, is going to be important.
Agreed. Yes. And we just went through a field trip here in Washington State, and Medicaid can sometimes be too complicated to even bill. Like the juice isn't worth the squeeze, but also can be an amazing option. Andrew, how about for you? What have you seen in Denver and your work across the country?
So in Denver, we actually had a unique funding opportunity. So we actually passed a ballot measure back in, I think, 2018 or 2019 called the Caring for Denver Foundation. And what this did was the voters basically said, we want a small percentage of, I think it's 25 cents for every $100 of sales tax revenue in the city and county of Denver is put into a specific fund to be used only for grants that address substance misuse, youth, and alternatives to jail. And so these were kind of funds that we could pull from, and we still do. Matter of fact, Denver 911 was fortunate enough to be granted a 3-year award from Caring for Denver, where we're going to start staffing clinicians within the 911 center, and kind of mirroring what a lot of 911 centers around the country are already doing, but in a kind of a unique way that will help to augment what we're already doing with STAR and DPD's co-responder program. So very excited about that. But again, that was a community-led initiative in Denver that resulted in that kind of permanent funding source. Beyond that, I would really just echo what everybody else has said, that there are a myriad of funding resources that you can lean on, but if you're serious about making this an ingrained part of city services, that it has to be general fund dollars, and it has to be just as assumed as funding your fire department or your police department. One of the things that we've been trying to do here is set up a dedicated dispatch position for the STAR teams, a citywide dispatch position where all they have to worry about are just STAR calls for service. Whereas right now it's being managed by the police dispatchers. So they've kind of got 2 buckets that they're trying to shuffle between. And the initial conversation was, okay, well, how do we find the budget for those individuals? And while, yes, that is a near-term challenge, my view is that we don't charge the police department for the dispatchers that I hire to dispatch their police officers. So we shouldn't be charging the STAR program for dispatchers to send their units to calls either. So we're working on how we kind of bake it into the cake, as opposed to trying to find these temporary and transigent funding sources.
Amazing. I'm so glad you are a champion of this work, Andrew. And you're part of the cake making. Candace, with SESA legislation, what have been some of the challenges around funding? Was it, funding baked into the CESA legislation? Has that been a barrier in the implementation? You guys won the legislation, and like, how do you win the implementation win, and any funding challenges that you're seeing there?
So interestingly enough, CESA was a no budget assignment legislation. What CESA wanted to do was curate what resources we were already using and figure out how to get those folks in a room to navigate and make decisions in a way. That is a challenge, but however, the same timeline that CESA was coming out, a lot of work around 988 was coming out at the same time. And so what we're looking at is building a continuum of care that includes all the elements of what that continuum of care looks like in a way that CESA could be coordinated still, but right now we don't have a budget line item to it. And because CESA, a lot of people don't know, CESA is not like a one size fits all legislation. It's really written in a way that you look at the municipality that you're in, the resources that you have, and create a plan around that. But oftentimes people think, oh, it's this one way to do it. This is how we're going to do it. And this is the way that it should be done. And that is not what CESA intent was. And it was because different municipalities look different. So like what can happen in a big city like Chicago may not be the same services or supports down in like rural Illinois. They might even have volunteer emergency responders or volunteer crisis response. And so the challenge is that we didn't have a budget line item, but that does not mean that the work can't get done. That means that we have to work our relationships and roles differently in order to accomplish the same goal.
Yeah, you just gotta roll up your sleeves is what I'm hearing, Candace, and make those relationships. Before we go to questions and answers, we're gonna do a rapid fire, y'all. So Melissa, what is your call to action for state leaders in this space?
I mean, we've heard it all throughout the time that we've been together, and that's just that community responders aren't a side project, and they're not destined to just be pilot programs. They really need to be a core part of our public safety infrastructure. They deserve the same seriousness, the same investment, and the same statewide coordination as any other emergency response system.
Yes. Amy.
So I agree wholeheartedly with what Melissa said. And I really think states need to look at legislation that establishes this as a first response service and provides some support for building the workforce and for communities to really stand this up so that it is a part of the infrastructure as opposed to, well, this year we have funding to do a few sites across the state, we can do this, but really to some legislation as well as some funding to help build that infrastructure.
Andrew and then Candace.
So I'll actually kind of go narrow. Again, the 911 guy talking about 911, but a lot of states have very strong state level regulatory bodies and oversight over the 911 system. Arizona is a perfect example that comes to mind, where it's the state entity that's actually making a lot of the decisions about the software that any 911 center anywhere in the state can use, from computer aided dispatch to the phone system to what have you. And there is a burgeoning conversation happening with these legacy public safety technology vendors that, hey, you guys need to start programming for programs like STAR and HEART and CARE and these others. And so as kind of state regulatory leaders, kind of putting money where our mouths are and saying, hey, we're only going to authorize our 911 centers to purchase software that supports these larger efforts and isn't just kind of relegated to dispatching police, fire, and ambulances.
This is Candace speaking. I would just leave with this, that this is a cost saving measure. A lot of people don't look at it like that, but in the long run, it really is. Also, we mentioned community a lot in this space. And in order for us to be in community, like we have to pull together and really figure out how this works. And so I'll just leave with it works. We have data. We just have to put the work in for the infrastructure in order to do it. And it's possible. And so I echo everything that everyone has said already, but just want to end with that.
What a
Can
great
I
way. Oh, sorry. Go, Amy, please.
Can I add one other thing? I think it's important that decision makers understand that mobile crisis teams, like through the mental health system and community response, aren't exactly the same thing. Um, so mobile crisis teams are typically Medicaid dependent, although they often get other funds. So they're narrower in terms of what they can respond to. And, you know, in some places, 911 may be able to dispatch a mobile crisis team from the mental health system, but in many cases, they don't. It goes through a different process. So when we're thinking about you know, I've seen budget decisions in some places that defunded the community responder team, saying that we had a CBHC mobile crisis team, and they're both important services, but they are different, and they have different constraints and different sort of scopes that they do. And I think that's important that as we make decisions going forward of building these things, that people understand those differences.
Thank you for elevating and uplifting that. I agree 100%. There's some nuances in the language, but there's enough people that need enough care in our communities, and really being mindful that we are talking about community responder programs here today that ideally get dispatched through 911 or 988 and are responding to more calls for service than our just traditional mental health, behavioral health calls for service. A lot of calls for service that really could be diverted to an alternative. Okay, with that, I'm going to pass it back to Felicia, who's going to manage the chat since I have been ignoring it, and start throwing y'all some questions.
Thanks. And thanks everyone that submitted questions. They're really great. So I'm just going to kick it off. And this might be a question for Andrew / Amy. How can state level efforts to support community responder programs ensure that local program planners are able to secure and analyze CAD data to create tailored local programs?
I'll jump on that one first. That is definitely a ongoing challenge. So CAD data is what Amos is referring to, is computer-aided dispatch data. And traditionally, getting access to those data requires CJIS certification, or Criminal Justice Information System certification. I mean, going back to the topic of involving folks with lived experience, that's often one of the biggest hurdles, is that access to these criminal justice systems is forbidden for anybody with a felony conviction. So, you know, when we talk about state level leadership getting engaged on this, it's starting to kind of, let's change the rules. Let's figure out how we can do what, you know, cities like Houston and Los Angeles and Chicago have been petitioning the Federal Bureau of Investigation to change their kind of enforcement of those rules to allow for folks with lived experience. May not be something that's going to happen in the next 3 years, but there is at least a conversation to be had. Outside of that, it can often be solved with a data sharing agreement, and, you know, certain kind of stipulations put in place about redacting criminal justice information. So there are ways around it that allow you to share information from a criminal justice system with non-criminal justice entities. It just takes a little bit of extra work and kind of finagling, which often, particularly in bureaucratic governments, can be the death knell of efforts like that. So it really requires a champion to kind of keep pushing and get that through.
Thank you. And there was a related question, another similar question about CAT data, but more broader, getting at what challenges or barriers you all are seeing with community responder programs, and like getting, hiring staff, implementing, funding, just any other challenges or barriers that you're seeing, and like, what are some innovations to addressing those that you have seen?
I would have to say Anna's the person that I've talked to that figured out how to overcome some barriers in getting people hired um, at for a community responder program. Um, and I think different communities are finding different ways of doing it, but um, I'd have to spotlight Anne.
I'll jump in real quickly, and I'm happy to respond. We could drop my email in the chat, but I think one of the things that Amy is referring to is we hired folks with lived experience with underneath a police department umbrella. So they were getting their paychecks from the Olympia Police Department, and they had felony convictions, or they had folks that had lived experience. And one of the things that we did, and Melissa, jump in because I don't want to speak for you, is that they were contractors at first. And so our police department got to know Melissa, got to know Keith. They got to know the folks doing the work. And so when it came time for me to like charge upstairs to the 4th floor of City Hall, the police department was like, we love Keith, we love Melissa, we love Natalie, like, we love these people. And so when they saw it was a person and not a crime, they were like 100% for hiring folks with lived experience. And so I think it's like breaking down those barriers of like, these are real people. These are the people doing the work day in and day out. So that was definitely one of the things. This is anecdotal, is that like folks that had lived experience that were working in Olympia hadn't really committed crimes in Olympia. So there wasn't like an arresting officer that had arrested somebody 15 times, and now all of a sudden they walk into the break room and that person's sitting there. So, and also like, and this is, I would love Melissa's perspective, is they had a little bit of time of recovery underneath their belts before jumping in. And I don't know if that's necessary, unnecessary, but it's a huge burden. I just talked to Keith, one of our original familiar faces, the other day, and in the beginning he felt the weight of the world not to screw up, like the weight of the world not to screw up, being a person with lived experience doing this work, so that other people be like, see, we tried it, it failed, like, and he's okay carrying that weight, and he's doing an amazing job, but it's a lot of pressure on both ends of the folks that are coming into the work, and then the institutions that are like opening up their doors.
I think the only thing that I would add is that it really helps to have leadership at the top who support, helping people break through traditional barriers. And also, like, if you hire the right people, the work speaks for itself. We made ourselves invaluable to the city, and therefore they were much more willing to sort of stretch beyond what had traditionally been possible there. And I want to just really quickly say also that, like, when I talk about lived experience as a qualification, it's a qualification. It doesn't supersede the others, and it doesn't supersede training. The person has to have all of those things in order to be successful in these roles, and in order to be able to serve the community in the way that the community deserves to be served.
So
Thanks,
one of
Becky.
the things we saw in Illinois, not necessarily in community responder services, but for hiring peers, agencies that bill Medicaid can have different background check requirements. It's criminal history, but also child welfare system history. And there are ways to appeal it, and there's work going on to look at changing a state law that could help. So that's where, thinking through if someone's starting a community responder program is really thinking through where it sits, can have different implications on what steps might need to be taken to make sure that you can remove the barriers.
Thank you. And this question is actually for Candace. How do you help shape the community engagement portion to be most productive in your work and in your efforts?
Um, community engagement is not a one-time thing. And so you have to be able to put it in rotation with all the other meetings that you have. Also, you have to be able to create an accessible environment where when you're sharing information, it's just not all terms that community members don't understand. And so creating a space where everyone is able to understand what you're saying. And then navigating getting around um locking in people for a certain title, because sometimes you might need a proxy or sometimes you might need someone else to be able to be available in order to fulfill the need of a community member. Because let's face it, we're all going through things and sometimes you just don't have the capacity to be at the table. And so being flexible in that, but staying locked in with organizations and community people that have this as a priority. So it's just not the new person that's coming in and don't really know the history of what's going on. I think are a few key elements of that.
Thank you. Does anyone else want to add to that before I move on to the next question? Okay. Melissa, this next question ties back to what you were sharing earlier about hiring people with lived experiences and making sure that they also have training, right? And all the other, things on the checklist. So someone's asking, how are organizations ensuring that people with lived experience don't feel tokenized or put on the spot to share potentially traumatic events?
That's a great question, and I am so glad that it was asked in this space because it is critical, and especially in organizations and agencies who haven't necessarily done this work before, it's really easy to fall into that trap. I think that the first and most important thing is that people have agency over their own stories. Nobody should be outed for that. For any part of their piece, they should have the ability to disclose on their own as they want to. And going back to they should have the same training. They should have the same they should have the I'm blanking on words. They should have the same skill set as the rest of the team, and therefore the only thing that sets them apart is that ability to connect in the moment when they need to.
This is Candace. I want to add, I think having someone to do one-on-ones with individuals prior to meetings and or in prep for meetings, I think is important. Especially if you know you're going to be making decisions on very key things. And so making sure that people understand like what the context of the background is in order for them to make that decision. And I think we miss that a lot because people are so used to like, this is the agenda, this is what we're doing, let's take a vote. And it's like, well, wait, what are y'all voting on and what is the backstory to what that looks like? Can we like take a step back first? And so bringing everybody to the center of the same level of understanding is important.
I also think so that people don't become tokenized is teams may want to more broadly prioritize lived experience in their hiring, as opposed to just a position for a person with lived experience, unless it's a specific peer support role, which I think is a different thing than what we're talking about right here. That can be a very valuable role too. But many teams that I've talked to have prioritized more broadly and had it in their job postings as well. And they can prioritize lived experience, and that can be broad too. It doesn't have to be a specific experience, but people that are bringing something to the work that helps them connect with members of the community that they'll be serving. So I think that could be really helpful too. And then it's not like, oh, that's so-and-so, that's our lived experience person.
Thank you. Well said. Next question. We at Heart Knoxville have received pushback on the call types that we're hoping to start our program with. The pushback is from law enforcement stating that all of the call types that we are proposing, such as indecent exposure, disturbance in progress, noise complaints, etc., are criminal in nature and thus require police response. Have you received that pushback, and how did or how did you navigate that, or how can we navigate that thinking?
I'm happy to jump in on that one. That is another hallowed refrain of programs like this, as they've tried to get off the ground around the country, and makes complete sense from that. Well, this is the way we've always done it kind of mindset. And my experience has been that they just don't know any better. And so anything that you can do in Knoxville to kind of provide some additional context, and one of the best ways is to have somebody who can speak to them, cop to cop, right? If you've got I love to volunteer the police chief here in Denver for those conversations, because he's more than happy to do it. I know we've got folks who are still kind of involved in a lot of this work. Paul Pazin is the former police chief here in Denver, is still very involved. I know Ernie Stevens is currently listening to the call right now. He's a great resource. I mean, when it comes to the 911 system, I am always more than happy to talk to my peers in any city that has concerns. And it's routine for us to kind of just share our policy and procedure and data and show, listen, here's the call tapes that we are dispatching community responders to. Here has been the outcomes of those calls, and just to kind of say, listen, you're really not reinventing the wheel. There are a lot of folks who have already kind of been through the difficulty of trying to get off this off the ground, and that shift in perspective can start to happen.
I would also, I mean, just even in the response is ask them to think about how often are they actually making arrests in those call types, or or where arrests would actually be useful, and kind of think from there, because oftentimes if officers are going out, they're not arresting. Arrest is a very small percentage of contacts that they have with the public. So kind of working back on what types of things might be more useful ways of thinking about it. But yes, also there's so many programs out there that are doing this work and could talk to communities thinking about doing this, and to law enforcement agencies, and really demonstrate that this is what types of calls we're going on, and it's working well, and actually officers appreciate it.
Great, thank
And if
you.
I can add one more thing,
Yeah.
because we are wrapping up. So where my head has been for the last few months, and all of the conversation in today's panel has just kind of further solidified the idea that what we need is an inclusive professional organization, one that is inclusive of co-responder programs, community responder programs, 988, state behavioral health entities, that can start to coordinate the efforts, not just on sharing information like this, right? To get a resource on how you connect somebody to a police chief, or a 911 person to talk to your police chief or 911 person, or a community activist to talk to your community activists. There should be not just a central repository, but an entity within which we can all be meeting regularly and sharing these ideas, but then also coordinating some of these efforts at a state and federal level. There have been a lot of conversations about what that looks like. I don't have the answer, but as everybody who's kind of thinking through this, that is a need that has I have heard identified in a lot of circles, and I think there's a lot of opportunity here for some additional advocacy as a professional organization, where it's kind of frontline folks as a part of all of that.
Wonderful. Well, thank you. I think that's a great spot to end. There was a couple of questions, or maybe a couple of questions that we weren't able to answer. We ran out of time, but we will definitely follow up after the webinar with responses. Emails are in the chat. If you're not able to access that, please reach out to me. My email's here. If you need anything. Thank you everyone for joining us today. We had such a great turnout. Again, we have recorded the webinar. Will be posted to our website along with the PowerPoint slides within a week or so. Please check out the Expanding First Response webpage on CSG Justice Center and subscribe to our newsletter. Thanks to all the panelists. Thank you, Anne, as well, for facilitating the discussion. This was a great time. I hope everyone has a great rest of the week.
Thank you all.